Good afternoon, ladies and gentlemen. Welcome to Medcast, where we explore the latest insight into medical care and well-being. Today, we are joined by Dr. Hasan Ashkanani, a talented dermatologist committed to helping patients achieve and maintain healthy skin. From addressing common concerns like acne and eczema to providing cutting-edge treatments for more complex skin conditions. Dr. Ashkanani will share expert tips on skincare prevention strategies and the latest technological advancement in dermatology. Welcome, Dr. Hasan.
Thank you for having me.
We are so honored and also so happy to have you here today. But Dr. Hassan, as a dermatologist, there's one common problem we have in the society. Most people think about the importance of the hair and they are frustrated with the hair fall. Could you please give us more explanation about the importance of the hair and why hair fall could happen?
Yes, of course. Thank you for your question. So hair is a very important component in our overall appearance. Its length, its color, its styling reflect our personality. It shortens our forehead, it brings attention to the face, and it's related to the overall view of beauty. Hair disorders are a very common complaint, and it's one of the very frequent reasons why patients visit us in our clinic. They can range from scalp disorders such as dandruff, oiliness, infections, to hair fall that can happen due to multiple reasons.
Now, could we say that there's more prevalence of hair fall between, in the ladies or on the women or females more than the males?
Okay, so when it comes to hair fall in general, it does tend to happen more in females due to multiple reasons. The causality of autoimmune conditions, which are conditions in which the body attacks itself, tends to be more common in females. In addition, there is one condition, which is stress-related hair loss. It tends to happen more in females solely due to the fact that it happens after pregnancy and giving birth. So it's called postpartum hair loss, and that tends to happen more in females.
Yeah, surely. Now, if we need to diagnose hair fall and the reason behind the hair fall, some people think it's very easy to diagnose. And I think there should be some symptoms you can see or notice on yourself if you are having a hair loss. Can we say that let's say the number of hairs fallen per day is one of the indications that give you a good indication to see or to know if you are having hair loss or not?
It definitely can be.
Yeah.
So, as a rule of thumb in dermatology, we tend to say that 50 to 100 hairs lost per day is normal. It could go up to 150 hairs per day.
Let us emphasize that.
Yes.
So 50 to 100 is normal.
Yes.
Okay, that's fine.
Yes, it is normal to lose up to 100, up to 150 actually in some seasons. But this isn't a rule set in stone for everyone. Some people tend to lose more on a daily basis. Some people tend to lose less. So as a rule of thumb, I tend to tell my patients, you know yourself, and you've been living for however long you've been living this far, and you know how many hairs you tend to lose per day. So if you notice more hair on your pillow, when you're brushing your hair, you're losing more hair in the shower drain, or if you find other symptoms such as your scalp has recently become painful or itchy or more oily than usual, this could be an indication that there is a problem, and then you can visit your dermatologist.
Okay. Is there any other diagnostic strategies or techniques you would use to confirm that the patient is having, let's say, a pathological hair loss?
Yes, definitely. In dermatology, we tend to utilize some common techniques. The first is common for all medicine, which is medical history. We interview the patient, we listen to their complaint, and then we follow that with physical exam. In our examination, we do something called the hair pull tests, in which we take a batch of hair, around 50 to 60, and we apply gentle tension to it and pull. And if we see more than a certain percentage, usually 10% of numbers of hairs lost, this tends to indicate that there may be a problem. A third technique would be using a magnifying lens called a trichoscope. When we use it for the skin, it's called the dermoscope. When we use it for the scalp, it's called the trichoscope. And certain features found can indicate certain conditions. So these are the techniques we usually use.
How about let's say, the clinical test you would do, like a blood test or something?
So blood tests can be an indication. There are some minerals, vitamins, and nutrients. If deficient, they can indicate hair loss.
People always say it's always relying on zinc levels. Is that right or not?
Zinc is one of them.
One of them.
Yes, we tend to use zinc, iron, vitamin D. Biotin is a bit controversial because it is very rarely deficient in people, and the supplement market tends to market it very incorrectly, and taking a wrong dose can have more harm than good.
Okay.
But in general, these are the things we tend to look at.
They always say biotin is the only or the best supplement for hair loss if you are having. So I would believe that you disagree with that statement.
I definitely disagree.
Okay, that's great.
Yes.
Now, if we think about the hair loss, we always think about the treatments, and some people might go directly into hair transplant. So apart from hair transplant, what are the available treatment options we have?
Okay. So available treatment options, for me to say that, it tends to depend on the cause. I will not give a treatment without knowing the cause. Because genetic hair loss or male pattern, female pattern baldness tends to have different treatments than, let's say, hair loss that is caused by a fungal infection, for example. But as a general treatment modality, let's go with the FDA-approved treatments. There are two. Topical minoxidil, which can be from different brands, and oral finasteride. Oral finasteride is a tablet that tends to reduce the level of hormone receptors that cause hair loss. These are the two approved treatments. Otherwise, it's all off-label treatments with different evidences of efficacy.
Now, can we say the supplements could be a treatment or just like supporting the health of the hair?
Yes. Supplements usually can be adjunctive treatments. There are some all-in-one supplements that have been studied and proven by a randomized control trial. These include supplements like Viviscal, Nutrafol, Neurocrine, with different levels of evidence. They include the required daily intake of iron, vitamin D, zinc, even biotin in the correct dosage. Yeah.
Now, sometimes, we hear about some topical preparations that can be applied apart from minoxidil, can be applied immediately to the scalp. Can they be helpful as well to keep the healthy hair?
They can be, but these tend to go under the realm of alternative medicine.
So they are not, let's say, real medicines.
Alternative medicine can be real medicine with different levels of efficacy. It depends on how much it is studied and proven. For example, rosemary oil, it tends to be a bit controversial because if not diluted properly and if not used properly, can do more harm than good. And even once studied, it is comparable to the weak concentration of minoxidil. So for myself personally, I tend to tell my patients, use the medications that are studied and proven.
And also be cautious with what you use, because not everything, let's say, is based on studies, and they might have more side effects than the benefits they might give you.
Definitely.
One of the things we always hear about is the dermapens as well, and the plasma injections. Lots of techniques we can hear about here treating hair fall. So are they useful or not?
There are studies supporting the benefits of the off-label treatments, like platelet-rich plasma, PRP, exosomes, dermapen or dermastamping. But as I said, the evidence is still not yet conclusive. So proceed with caution and go to a board-certified dermatologist who knows what they're doing.
Now, if a patient having a family history of hair fall, could that affect the patient himself or not?
Yes, definitely. The genetic type of hair loss called androgenetic alopecia, and also called male and female pattern hair loss, this is mostly inherited. People tend to have a family history. Usually for men, they have a maternal family history, and it tends to manifest in different ways. In men, it manifests as receding hairline and balding at the crown. In females, it is more diffuse hair loss, widening of the midline, and it tends to be more severe in men. And there is definitely family history for this.
If the patient, or let's say the suspected human, is having a family history, is there any way to prevent, or at least to make it on a later stage of age, or prevent hair loss using any supplements or means or something?
Yes. Proactive preventative treatment is one of the things that we can use to delay androgenetic alopecia. Unfortunately, it is in the genes. So far, there is no way for a patient to come to me and I tell him, if I give you this, you will not experience androgenetic alopecia. Treatment is lifelong. You have to commit to it. But with successful treatment and good response, it can definitely be delayed.
Okay. Dr. Hasan, your speech was very fruitful, but unfortunately we have reached to the end of our segment. We were so pleased to have you. Hopefully we can meet you again.
Thank you so much.
Thank you so much. Our dear viewers, we have reached to the end of our segments with Dr. Hasan Ashkanani. Hopefully we can meet you again later on with another medical specialist. Until that time, see you later.